Performing high perfusion CPR is essential if our patients are to have any meaningful chance at surviving cardiac arrest. Thankfully, there are tools that can help us to get it right. One of these tools is the ResQCPR system, which provides IPR therapy to increase the likelihood that more of our patients survive cardiac arrest. Before we can understand how the ResQCPR system helps enhance perfusion during CPR, it's important to understand how blood is moved during CPR. During cardiac arrest, everything stops and the body can no longer regulate breathing and blood flow. We must move air and blood for the body by doing CPR. We compress the chest, which creates positive pressures to push blood out of the heart. Good chest wall recoil creates a small amount of negative pressure in the chest to pull blood back to the heart. However, because the patient's airway remains open and unregulated during cardiac arrest, air rushes in, wiping out much of the negative pressure in the chest and limiting the amount of blood pulled back to the heart. The ResQCPR system replaces what the body does normally, regulating pressures in the chest in order to increase blood flow and perfusion during CPR. Let's take a closer look at both components of the ResQCPR system and how to use them effectively. The ResQPod ITD-16 is a single-use device that fits on a face mask or an advanced airway. During chest compression, a one-way valve in the ResQPod opens, allowing air to be pushed out of the lungs without resistance or affecting ventilation. As the chest wall recoils, the valve closes, preventing air from being pulled back into the lungs. This enhances negative pressure in the chest, pulling more blood back to the heart. The ResQPump Active Compression Decompression, or ACD, CPR device helps chest recoil. With the ResQPump, you are not only able to compress the chest, but you can actively decompress or lift the chest during CPR with up to 10 kilograms, which creates even more negative pressure in the chest, improving blood flow. A gauge on the ResQPump handle helps you to estimate how hard to compress and how hard to lift. The green portion shows compression, while the purple area shows lift. The bottom of the red arrow lets you gauge the strength of your compression. Because more blood is being pulled back to the heart during active decompression, ResQCPR is done a little slower at 80 compressions per minute. This allows a little more time for the heart to fill. Since 80 compressions per minute is slower than what you're used to, an audible two-tone metronome is available to help guide compression rate. Push the button once to turn it on and once more to turn it off. The metronome has a battery-saving feature in case it is accidentally activated when not in use and will automatically shut off after 10 minutes. If this occurs during use, simply push the button again to reset. Because the ResQPump uses suction, you may notice some reddening or bruising on the patient's skin under the suction cup. This is common and should not be of any concern during CPR. Keep in mind, even when performed correctly, there is always potential to break ribs, no matter what type of CPR you are performing. If you suspect rib fractures, check to make sure you are compressing in the proper position and continue. The suction created with the ResQPump may actually help with chest wall recoil should rib fractures occur. After each use, the suction cup may be cleaned or replaced. The handle can be wiped clean, but should never be submerged in water. See the instructions for use for the proper way to disinfect both the handle and suction cup after use. Because the ResQCPR system enhances blood flow to the brain and other vital organs, there is a chance that while providing ResQCPR, your patient may show signs of improved levels of consciousness despite not having a pulse. If you see signs of consciousness, quickly check for a pulse. If there is none, resume ResQCPR. If a pulse is present, remove both devices and continue care as directed by your local protocols. Now that you know how the ResQCPR system works, let's talk about how you perform high-quality ResQCPR. First, make sure the patient is pulseless and that CPR is indicated. Place the ResQPump in the middle of the patient's bare chest, making sure that the edge of the suction cup is above the xiphoid process, and the devices such as defibrillation pads do not interfere with pump placement. If the patient's chest is excessively hairy, it may be necessary to shave it quickly in order to get good suction. In the case of the wet or diaphoretic patient, dry their chest with the patient's clothing or a towel to minimize pump slippage. Next, get into position. The The correct body position for ResQCPR is the same as for conventional CPR. Shoulders directly over the sternum with your arms straight. If the correct position is not achieved, the rescue pump may slip or lose suction. With ResQCPR, your hands will be higher than during conventional CPR. Shorter rescuers may benefit from elevating their knees on padding to achieve proper positioning. If the patient is on a stretcher, lower the stretcher in order to correctly position yourself above the patient. As always, make sure the patient is on a hard surface anytime you're providing CPR. Now you are ready to go. Lightly grip the rescue pump handle and turn on the metronome. Begin compressions at 80 per minute, bending at the waist and using your entire upper body, not just your arms, to compress. Each compression should be at least 2 inches in depth. Using the point of the arrow on the gauge, note how much push is required to achieve this depth and use that as your target. To lift, keep your arms straight and use your entire upper body to lift with enough pull to see 10 kilograms on the gauge. It is not necessary to lift more than 10 kilograms. This is what the gauge looks like with 10 kilograms of lift being applied. ResQCPR is hard work. Be sure to rotate duties at least every 2 minutes, or more often if you're tired. Sometimes it may be difficult to maintain good suction with the rescue pump. Here are a few things to check if you're having any issues. Make sure the edge of the suction cup is not too low on the chest. It must be above the xiphoid process. Ensure devices such as defibrillation pads are not interfering with the suction cup. Check your position. It's important to have your shoulders over the sternum and push and pull straight up and down. If the rescue pump dislodges, reposition it and use less strength to pull up on the next decompression. If you're not able to pull up with 10 kilograms of lift, lifting the chest wall to neutral will be helping the patient. If suction difficulties distract you from performing good CPR, discontinue use of the rescue pump and continue high-quality CPR, leaving the rescue pod in place. While compressions are being given, another rescuer should assemble the face mask, placing the rescue pod, end tidal CO2 sensor, if available, and BVM in that order. As soon as possible, spread the cushion and position the mask over the patient's nose and mouth. A good face mask seal is critical to getting the best results with the rescue pod. Ideally, the person managing the airway maintains a tight two-handed seal, while another rescuer ventilates the patient. You may also consider using a head strap to help you maintain an airtight seal. Now open the patient's airway, being careful to lift the jaw toward the face mask. Ventilate the patient over 1 second and with only enough tidal volume to achieve a chest rise, using the compression to ventilation ratio in your local protocols. Once an advanced airway has been placed, move the rescue pod to the airway and turn on the timing assist lights. Ventilate each time the rescue pod's lights flash, which is once every 10 seconds. Once the pulse returns, remove both devices. If the patient rearrests, reapply both devices. Now let's watch a demonstration of high-quality ResQCPR. Make sure you are properly positioned above the patient with your shoulders directly above the patient's sternum. Bend at the waist, keeping your arms straight, and use your entire upper body to compress to a depth of at least 2 inches and lift with 10 kilograms on the gauge. Use the metronome to guide compressions at a rate of 80 per minute. Apply the rescue pod early and maintain an airtight face mask seal. Rotate duties at least every 2 minutes to avoid fatigue. When a pulse returns, remove both devices immediately and treat the patient based on your local protocols. And if the patient rearrests, reapply both devices and resume ResQCPR. The ResQCPR system, with its rescue pod and rescue pump, works to enhance negative pressure within the chest during CPR, which improves perfusion and increases the likelihood that more patients survive cardiac arrest.